Ask the Doctor with Michael Lange begins in 10 seconds.
When it comes to your health, are you seeing the check engine light come on more than normal? It's time to get under the hood. It's time for Ask the Doctor with Dr. Michael Lange. Sponsored by Lange Eye Institute and Fortify Vitamins. Dr. Lange is a board-certified optometric physician and certified nutrition specialist, helping people see and feel better through proper nutrition for 25 years. The doctor is in. Call now with your questions at 877-969-8600. That's 877-969-8600. Here's your host, Dr. Michael Lange.
Okay, good morning and welcome to Ask the Doctor. I'm your host as usual, Dr. Michael P. Lange of the Lange Eye Institute and Fortify Vitamins, here each and every Saturday morning live to answer any and all questions you may have regarding your vision, eye care, or a nutritionally related topic. Folks, I've been hosting Ask the Doctor since April of 1993, nonstop. One of the longest running doctor-hosted talk shows known to man. And it's good morning, good afternoon, and good evening, just depending on what part of the world you're watching or listening. So we're live video streaming all over the world. We're coast to coast via a multitude of radio stations. And of course, we're on a multitude of social media. Also, I want to let everybody know that there's a lot of fake Dr. Michael Lange social medias out there. Follow me on Instagram. That's Dr. Michael Lange _ Dr. Michael Lange _ on Instagram. I have a blue check. And I don't know, about 60,000 followers or so. All the rest of them are fake. There's 250 fake or more. Every day there's new ones created. So beware and be careful. A lot of you are being ultimately scammed by fake Dr. Michael Lange. That's sad. You're getting catfished. So if you think I have been chit-chatting with you for a long time, there's a select group of you that we've become friends with, but there's not many, maybe one or two. And I still don't talk much. So if somebody's holding on a conversation with you and you think it's me, it is not. I don't have time. Happily married, great family, and I'm not chit-chatting with you. So beware and never give any money over the internet for whatever. Philanthropic for money that you think I need. I don't need your money. Do not give money. All right, that's my disclaimer. Also, this is for educational purposes only. Never replaces a comprehensive eye examination. All right. I'm a board-certified optometric physician. I'm also a certified nutritional specialist. I also have degrees in psychology and physiological optics. So that makes me an expert on answering your questions, plus plenty of years of experience, hundreds of thousands of patients I've seen over the years. Give us a call, and I say it us because Dr. Susan Summerton is my co-host, of course. Give us a call at 1-877-969-8600. That's 1-877-969-8600. You can learn a little bit more about the supplements that we're involved in creating, the research that we do on these supplements. These supplements made by Fortify Vitamins are, we tell you exactly what's in it. We give you a science section, proving why we put the ingredients in it. Full transparency. We don't have any proprietary blends. And you can learn more at fortify.com. That's FORTIFEYE, fortify.com. Also, Dr. Susan Summerton is a diplomat in the American Clinical Board of Nutrition. She's a fellow in the Ocular Wellness and Nutrition Society. She's also a certified nutritional specialist and an optometric physician. And she is on staff at the Lange Eye Institute and Fortify Vitamins. And she is an asset to all of us. Good morning, Dr. Summerton. How are you?
Good morning. Happy to be here today and looking forward to answering the callers' questions. And I do want to reiterate with the social media, I know personally, even just this week, I got 3 fake profiles of your image. They're actually your picture that's friend requesting, and they even have personal pictures of you with your dog or with your daughter. And it looks like it's a real picture of you asking to be a friend. But it is not. So we go ahead and delete those and don't accept them. And then
Absolutely.
also, we all about truth, and that's what we're here today. We try to sort through what's real on the internet, what's not true on the internet, and try to give you that information that we know is backed by science.
Yep, we try to tell you what is reality. All right. You can also see Dr. Summerton or myself or Dr. Caputi at the Lange Eye Institute in the Villages, Florida. The Lange Eye Institute, the phone number, I'll give it to you twice, is 352 753 4014. That's 352 753 4014. Also, they are answering the phones at Fortify Vitamins this Saturday morning. And the phone number for Fortify Vitamins is 866 503 9746. That's 866 503 9746. Also, we're still running the BOGO for the rest of this month. So take advantage of it. And it will be over at the end of this month. The BOGO on the organic blue-green superfood, which is amazing, berry flavored, all certified organic, gluten-free and FODMAP-free, and paleo. So organic blue-green superfood is a BOGO, buy one, get one free at fortify.com. And our advanced retina formula. Now, the advanced retina formula does have short dating, couple of 2 to 3 months, it does expire. Folks, these don't expire for many years after the expiration date, but that's another reason we're running a BOGO on those. The superfood, when it doesn't expire for another year or so. So take advantage of the advanced retina formula and the organic blue-green superfood. A BOGO means buy one, get one free on the website. You don't have to do anything. You buy one, you automatically get two. You buy 8, you automatically get 16. All right, let's go to the phones. Let's see. Nancy and I think Summerfield. Good morning, Nancy. Welcome to the program.
Morning.
Morning. What can I do for you?
Yes, I wanted to ask the doctor why I am still having continuous blurring in my cataract operated eye 3 weeks post-surgery.
Aha. So that's a great question. Without seeing you, I wouldn't know 100%, but I can tell you the potential issues. So post-cataract surgery, oftentimes we have inflammation. Some people have more inflammation than others. That's why you're on an anti-inflammatory and a non-steroidal drop for up to a month. So you should be, if it's 3 weeks out, you should be still taking those medications, those drops. Are you? You there, Nancy? Okay, she's there. All right. So you should be still taking those drops. And then also, sometimes we get corneal edema, all right? The swollen cornea, which is a form of inflammation. And sometimes it takes a little while for that swelling to go down. And also, you can have very dry eye after
Yes.
cataract surgery. Good.
Yes.
Okay, so you can also
Yes,
have.
I am.
Yeah, it's a little bit
Yes.
delayed. You're listening to the obviously, we're delayed about 10 seconds or so on live. That's why it took a while to answer. But so it could be dry eye, it could be inflammation inside the eye, it could be corneal inflammation, it could be the refractive error. That means the prescription, the doctor that did the surgery didn't nail it perfectly, and maybe you're going to need glasses to correct for astigmatism or nearsightedness or farsightedness. These are things that we deal with at the Lange Eye Institute all the time. Dr. Summerton, you want to add some other things that could potentially be causing this?
No, I completely agree. When they do the surgery, they make a little small incision at the side, and that incision can be swollen. When they actually are removing the lens, the cataract, they apply energy, and when the more energy they have to apply, the more likely you're going to have a little bit of inflammation after. If you've got that inflammation in the center right in front of your pupil, it can really affect your vision. If it's off to the side, it might not be as bad, but any little tiny change in the cornea, that front surface of the eye, even less than the width of a hair, can dramatically change how you see. So that's why we say wait until a month. That's when you're done with your drops, when we check the glasses prescription, because we have a more idea of what it's going to be like and consider it fully healed at that point.
Thank you for that, Dr. Summerton. And Nancy, so give it a little more time, but obviously get back to the ophthalmologist that did the surgery or whoever's doing your post-operative care and ask them these questions. Ask the doctor, whether it's us or whomever it is, and they should be able to go with it. But I think you're going to be fine. There's also one last thing that could be, sometimes you can develop something called CME, cystoid macular edema. That's when the retina swells, but that's why we put you on these drops. It's crucial to continue taking your drops per the instructions. Like I said, if your vision isn't adequate, get back to the doctor that did the surgery. Okay, Nancy? And thanks for the call. All right. Let's see. A lot of people don't realize we're a little bit of a delay. You're listening to Ask the Doctor. Give us a call at or Ask the Doctors, 1-877-969-8600. That's 1-877-969-8600. Dr. Summerton and I deal with postoperative complications from cataract surgery on a daily basis. The Villages, Dr. Summerton, the Villages is really kind of like the cataract capital of probably of the globe, isn't it?
Right. I mean, everybody pretty much ends up getting cataract at some point, and the difference is really how fast they progress or what type of cataract they have. So every single day we're looking at cataracts under the microscope, and it's just determining these cataracts, fine, we leave them alone most of the time. As long as the patient is seeing great, doing great, seeing all the things they need to see, those cataracts are fine left there. But when it starts interfering with their life and not being able to see, they can't see their drive, it's affecting their daily lifestyle activities, that's when we have to think about sending them over to one of our excellent surgeons in the area to be able to remove them to improve that vision.
And there's one other thing that a disease entity in the eye that a lot of people get as we get older, called macular degeneration. And macular degeneration is something I like to tell people that this is a disease that is a nutritionally responsive disease. All right. It's not a cure. There is not a cure for macular degeneration. It comes in two forms, basically, the dry and the wet form. The dry form is the least visually devastating and the slowest. The wet form is the fastest acting, and that can cause, quicker visual disruption. There are some injectable treatments for both forms of dry and wet. You have to have the geographic atrophy form for the dry. The jury's really still out on this. It's not a miracle cure by any means, but I have seen the power, and Dr. Summerton and I both have seen the power of proper nutrition. So when we do a combination of things for our macular degeneration patients, we counsel them on weight management, okay? If you're obese, you know who you are, you got to lose weight, because there's definitive science out there showing that people that are overweight are more prone to have all eye diseases, including macular degeneration, dry eye, and glaucoma. So we got to practice weight management. If you're overweight, you got to lose weight. Wear blue filtering lenses and UV filtering lenses. So when you get your new glasses, make sure they put the blue filter and the UV filter. I like blue light defense and blue light shield the best. Make sure you're on a good diet, like the paleo diet, the Mediterranean diet, the Lange survival diet. You can Google that. And I did not say the carnivore diet or the ketogenic diet. Both of those have some potential problems. Now, the carnivore diet and the ketogenic diet are great at losing the weight. And remember, in the beginning, I said weight management is great for macular degeneration. So the carnivore diet or the ketogenic diet is probably decent for that. But remember, and we'll talk about this more, the ketogenic diet now has been proven to actually cause lipids to go up, all right, in your body, all right, short term. And also, people on the ketogenic diet need more probiotics. It's relatively new science, Dr. Summerton, out there, isn't it?
That's right, because all this on our, what we call our gut microbiome, people have probably heard that word a lot lately, because there's so much more research on how important all those little microbes in our gut and that they're balanced. And you can hear that word dysbiosis sometimes too. And that's when basically it's not balanced between what we call the good and the bad, or the beneficial bacteria. There aren't enough. Well, what they did in this latest ketogenic low sugar diet, they realized that it does actually affect our microbiome. And one of it that it affects is what we call bifidobacteria, and that's one of the beneficial ones. And there's different species of it, but it is so important to maintain that, because that's what's going to help your immune system. It's what's going to help your digestion. It even helps with our fatty acids, what we talk about with our omega-3s and digesting and converting those. It even helps produce the B12 in our gut. And so we really don't want to lose any of these good bacteria, and whether it's by improper diet or imbalance in diet or antibiotics. We prescribe antibiotics all the time, but whenever we do that, we want to make sure we put our patient back on a probiotic to regenerate, and then eat the foods. Another word that's kind of popular out there is prebiotics, and those are the foods that you eat that can help with fiber and help just give the nutrition to these bacteria, the good bacteria that's in the gut. It can get really complicated, but what it comes down to is eating that balanced diet and, watching what you eat, because it affects your whole body as far as your immune system and how you live your lifestyle.
Amen. You are what you eat. And everybody should benefit or will benefit from eating some foods that are high in probiotics. These are fermented foods. So yogurt, but if you're on a ketogenic diet or even a carnivore diet, you need to eat that low sugar yogurt. But things like kimchi and sauerkraut, these are fermented foods, and they're going to replenish these microbes that you're not getting in the typical ketogenic and carnivore diet. Like I said, the carnivore diet and ketogenic diet is a great way to lose weight quickly. But also remember, you got to eat protein. We've talked about that for the last month, how people that are on these GLP-1 receptor drugs and these crash diets, they're losing weight fast, but up to 40% of their weight loss is muscle loss. So that's why protein is so important. I'm holding up in front of everybody right now a whey protein isolate fortified vitamins developed. This is grass-fed whey protein isolate. The only thing in it is grass-fed whey isolate and sunflower lecithin, and that's it. And so most whey proteins have been polluted and adulterated, and most of them are coming from countries you don't want to purchase from. So a good whey protein or our new vegan protein, we have a new super vegan protein for those of you that are vegan that has 21 grams of protein, has amino acid profile, branch chain, and essential amino acids, that of whey, and a PDCAAS score of 1, just like milk and whey. So now we have a vegan alternative called Fortified Vegan Super Protein that is a complete protein, and it's from upcycled barley and sprouted non-GMO pea and sprouted barley, and we add velocitol, kind of double the amino acid power. So now we have Fortified Super Protein, Fortified Vegan Super Protein, and the Fortified Grass-Fed Whey Isolate. More protein is important for all of you that are on diets. Remember, protein has virtually no carbs and very few calories. You got to get more protein when you're on these diets. So we're getting ready to go to the next caller in just 1 second, so stay tuned for the callers out there. Talking about diet for macular degeneration, like I said, Lange survival diet, Mediterranean diet, paleo diet, those are great. Lose the weight, get down to your ideal body weight, eat more dark green leafy vegetables. However, beware of spinach. Spinach is polluted with lots of pesticides, and spinach is very high in oxalates. It's the highest food on the planet with oxalates. The oxalates are off the scale. Oxalates are hard on your kidneys and increase your risk of kidney stones. However, studies do indicate, like Dr. Summerton mentioned, if we have the right probiotics and the right gut flora, the microbiome is in good shape, it will minimize the chance of you getting these kidney stones, oxalate-related kidney stones, especially from spinach. Also, if you pair spinach with cream or a milk, like goat's milk or goat's cheese, that can reduce the chance of you getting kidney stones. But here's the kicker. Simply substitute spinach with baby leaf organic kale. Tastes just like spinach. Baby leaf organic kale, very high in lutein. Eggs are good for macular degeneration. Blueberries are good. Never use blueberries. Dr. Summerton, we never take blueberries with what other foods? There's 3 other foods.
Are foods that turn brown, basically, like the bananas and the pears and the apples.
Yep.
We want to make sure we get the maximum absorption. We can eat them, but we just don't want to eat them together, blended up.
Yep. So remember, and when you're having berries, don't have banana, pear, or apple. You can have those separate, but not at the same time, because the polyphenol oxidase in these bananas, pears, and apples will block the absorption of the flavonoids. Same thing with carrots and sweet potatoes. Don't eat carrots and sweet potatoes with your baby leaf kale, because beta carotene that's in carrot and sweet potatoes will block the absorption of the potential lutein that's in the kale, the zeaxanthin that's in orange bell peppers, and the astaxanthin that's in wild Alaskan salmon. So also eat more orange bell peppers and wild Alaskan salmon. Boom. Now you know the foods to eat for macular degeneration. Make sure you're doing a little exercise to improve circulation, and then taking the right supplements. We're going to talk about supplements in a minute. So we have Fortify Macular Defense, zinc-free macular defense, and we have Fortify Advanced Retina Formula. And we'll tell you a little bit more about those in just a minute. But we're going back to the phones. Let's go to Steve in Clearwater. Steve, good morning. Thanks for holding.
Yes, I'd like to ask a practical question this week for a change. There's a lot of times where you can monitor your own body. For instance, a diabetic can monitor his sugar, so he can monitor his pancreas. An athlete can monitor his heart rate and his blood pressure, so he can monitor his heart. And a woman can monitor her breast by giving herself self-examinations. Is there any way or anything you can do to monitor your eyes and your retinas? In other words, any self-examination that you can do just like those other people do on other systems of the body?
This is difficult. You can actually just check your vision. That's about the only way I know. Visual acuity, cover your and the distance, check distance vision, and make sure the eyes are similar, both eyes, when you're looking in the distance. But one of the best ways preventatively is go to your local optometrist or ophthalmologist or optometric physician and go to a practitioner that has an optomap. An optomap is a non-invasive way of looking at the entire back of the retina without dilating your eyes, okay? So there's a lot of people that freak out about being dilated, all right? And some people, quite frankly, shouldn't be dilated because they have narrow angles or they're on certain medications that the dilation drops can interfere with, especially phenylephrine. So an optomap is a good form of prevention, not only for eyes, because we're certainly looking for the first signs of eye disease like retinal tears, retinal detachments, macular degeneration, glaucoma, but also the optomap can look at the vascular system, look at the tiny little capillaries, the veins and the arteries, to see if there's any plaque building up, to see if there's any defects in these blood vessels that could be atherosclerosis, could be high blood pressure, could be diabetes. So a lot of systemic diseases show up on this optomap. So if anybody gets anything from this show today, routinely, I recommend annually, especially after 40, getting an eye exam every year and having an optomap. That's a reason to see a doctor with an optomap. Now, a lot of doctors will say, well, I dilate you and I put my indirect ophthalmoscope on and I can see everything I want. That's not true. I mean, Dr. Summerton, even us, and we've been in business and practice for a long time, and I think we're great clinicians, but even us we can miss things where the optomap picks them up, doesn't it?
Right, because we can see the big picture all in one screen, whereas when we use our microscope, we're looking at micro pieces of the eye, and we don't get that full perspective in one view. And it's just, if you think of just having, even if you're looking at your body, if you can take the whole perspective in one view, it just gives you more information. And really, like what Steve was saying with the eyes, we're pretty much monitoring our eyes every day. And what we look for is change. If there's a sudden change from one day to the next, if one day your peripheral vision doesn't work right, that's something wrong. If one day all of a sudden the eye goes blurry, that's something wrong. With macular degeneration, we do give our patients this traditional kind of homework, which is called the Amsler grid. That's been used since like the 1940s, and it's like a little map of the macula. Anyone out there with macular degeneration probably knows what I'm talking about. It's this little dot in the center on a piece of paper, and it's full of these little squares. And we're looking for if the squares become wiggly or missing spots or changes in the color. Again, looking from change from day to day from one eye to the other. And it monitors that central 20 degrees of the eye. And so if there's a sudden change in that, we know that macula has changed and they need to come in right away, because obviously you can't come in all the time, but we know in between your visits, if something changed, that alerts you to get in right away.
And also, if your eyes are not comfortable, there's a potential problem. So if the eyes are painful, okay, aching, sandy, gritty, burny, teary, itchy, any symptom like that, and you put some artificial tears in like Oasis or Optase, and these symptoms don't go away, then obviously you need to get in to see your doctor.
Very good. And one real quickie question: when a person has poor light adaptation, they come in from the sunshine and their eyes don't adjust to the lower light very quickly. What's causing that? Is it that the pigments don't regenerate, or what causes that slow adaptation compared to a normal person's adaptation?
Right. So a lot of people that have poor nutrition, believe it or not, they're not eating foods that are high in the carotenoids, will have poor dark and light adaptation. They'll have a lot of problems from glare issues, rebound. So if you get blinded by a light, the rebound will be much slower. And we have pretty sophisticated tests that we can do in the office to see if you're one of those candidates. And there's studies that indicate if this rebound, all right, once they flash you with a bright light and it takes a long time for you to recover, this can be the earliest signs of macular degeneration. So it's a dark adaptation test that we can do. And we've seen patients that when we put them on our Fortify Focus or our Focus and Brain, which is high in lutein, zeaxanthin, and astaxanthin, we've seen this rebound time decrease dramatically. And that's one reason a lot of race car drivers, including myself, use the Fortify Focus, is because if you're driving, especially a race car at night, and you got an oncoming, you're at a track like Daytona or let's say Sebring, because that's where you can have oncoming traffic coming toward you, not really at Daytona. So you can be blinded. And if you're going 200 miles an hour close to that and you get blinded, that's a big problem. So eating more green leafy vegetables, orange bell peppers, wild Alaskan salmon, or taking something like Fortify Focus or Fortify Focus and Brain can help. The exact science would get kind of in depth, how these photoreceptors are working, how the cones are working in relationship to the rods, because they all work together. Dr. Summerton, you want to add anything to this?
Right. Those lutein and zeaxanthin that we speak about all the time and we recommend all the time, those are two of what we call carotenoids. And there's about 700 or more carotenoids, but those two are amazing. They find their way all the way past your blood-brain barrier, and your brain is picky about what it lets in. Then it finds its way through your blood-retina barrier. And again, your retina is picky about what it lets in. And they're actually stored in your macula, and they're little yellow pigments. And that yellow acts as sort of an internal sunscreen for that damaging blue wavelength light that can reach your macula there. And because we're bombarded these days with the blue light, we need to be really conscientious about making sure that we get those nutrients in our system, because we're not going to be able to avoid the blue light, but we can do all we can. Just like we think about putting sunscreen on our skin to protect it from the UV light, we need to put those internal carotenoids, get that lutein and zeaxanthin to absorb that damaging blue wavelength light. And it's just amazing to me when you think about how they get into your system and all the barriers that your body has, and it finds its way right there to your macula.
What do you think about that, Steve?
I think that's an excellent explanation from your asset there, and and we hope you have a great day. And one more thing, I'd like to ask the audience a favor. There's a friend of Dr. Lange's who needs some prayers right now. And after the show, if everybody take 2 or 3 minutes and say a prayer for Dr. Lange's friend. Okay?
Thank you, Steve.
Okay, God bless.
And specifically, that would actually be my brother. So I would call him my friend as well. So, he's going through some heart issues, had some prostate issues, and then he got atrial fibrillation. And then they went in, I went down to St. Tammany Hospital in Louisiana this last week with him to get shocked, cardiac aversion. And for 8 hours, he felt amazing. We went out to dinner, had, a great dinner. And then 8 hours later, atrial fibrillation's back. But now he's having sleep issues. And who knows if it isn't related to, anxiety, but now he's about to freak out because he can't sleep at all. I mean, for the last 5 nights, no sleep whatsoever. Of course, I've given my recommendations, and, he's Dr. Google, and he's looking everything up on there, and now wants to get on some crazy drug recommended by some kind of off the wall internet doctor, and that can put you in a coma. So yeah, prayers would be great. I appreciate it. I don't really ask for help from anybody, but yeah, prayer for Big Rick. That's Rick Lange, would be appreciated. Thank you, Steve. All right, you're listening to Ask the Doctors. I'm Dr. Michael Lange, and my co-host, Dr. Susan Summerton. We're here to answer your questions regarding your vision, eye care, and any nutritionally related topic. Give us a call at 1-877-969-8600. That's 1-877-969-8600. Also, you can learn more about the supplements we've been talking about at fortify.com. That's FORTIFEYE, fortify.com. I'm going to give you the phone number for Fortify Vitamins. If you want to order the Fortify Focus that we've been talking about, or any of the macular degeneration vitamins we're getting ready to talk about, you can call Fortify Vitamins at 866-503-9746. That's 866-503-9746. One of the biggest problems with sleep is all of us, I mean, just about everybody listening, including me and Dr. Summerton, we're on the computer, the iPad, or the iPhone way too much, especially in the evening. And that emits some blue light that potentially can cause sleep problems. And I think my brother's on his cell phone for 24 hours a day. What do you think, Susan?
Right. And blue light in itself is not bad. We do need blue light in the morning when we wake up. That's what rejuvenates and kind of makes us alert. So we are supposed to get some in the morning, preferably outside in the sun. But at night, we don't want that blue light minimum an hour, preferably 2 to 3 hours before bed, because it will tell your body to not release melatonin. And people know melatonin that helps them sleep, but really melatonin's power comes in it a super healer. It's an antioxidant our body releases while we're sleeping. And so while you're sleeping, you want that healing power of melatonin to do its job of what it's even been shown to eat through tumors in your body. That's your own naturally released melatonin. So we want to get the full benefit of that and avoid that blue light before you go to bed. Now, I myself have been guilty of it, of looking at my phone, but I do have the blue light blocking glasses. If I am going to have to look at something on the computer or check my phone, I've got those glasses on when I'm going to bed at least 2 hours before, and they do help, but good quality ones.
And I gave my brother some blue blocking glasses, and of course he doesn't wear them. He wore them for 1 or 2 days and said, this doesn't do anything. So once again, Dr. Google. All right, phone lines are open. Today is actually, I think it's August 17th, 2024. I apologize. We've run a lot of tapes recently since I've been back and forth from New Orleans. My daughter started college in New Orleans. She's at Tulane last week, and she's loving it. I told her, you got to understand the New Orleans crowd's a little bit different. She said, Dad, you are correct when you said they party till they puke or they party till they pass out, because she's seen it all over New Orleans. So it can be a crazy town, but luckily she has a good head on her shoulders. And my wife, Tammy, and I have taught her well. So I've been back and forth from New Orleans about 3 times over the last 3 weeks. So we ran a lot of tapes, but today we are live. Like I said, it's the 17th of August. Give us a call, 1-877-969-8600. We're getting loaded up on the phones now, but I want to talk about briefly, we have 2 forms of macular defense vitamins on the website, Fortify Macular Defense and Fortify Zinc-Free Macular Defense. Now, either one of them are fine for you to take. The one with the zinc, the zinc only has 30 milligrams of zinc in 3 capsules. So the reason we have a zinc-free one, we were involved in some DNA, FDA-approved post-AREDS2 macular degeneration DNA studies years and years ago. And we found out that there's a certain population, percentage of the population with a specific DNA, that the zinc is probably not really great for their macular degeneration and other parts of their body. So I ask I ask 4 questions to my patients. Are you on a diuretic? If you're on a diuretic, you need extra zinc. Do you have IBS, Crohn's disease, or ulcerative colitis? If so, you need the one with zinc. If you drink any booze, just 2 glasses of alcohol a night, you need the one with zinc. If you're a vegan and you're not eating any animal protein, you need the one with zinc. It's called Fortify Macular Defense. Otherwise, Fortify zinc-free macular defense is probably fine for you. The zinc-free macular defense has been on back order for a week or so. We will have plenty in about 5 more days. It'll be in. So remember, Fortify Macular Defense and Fortify Zinc-Free Macular Defense. Folks, this is not an age-related eye disease study formula. It has all the vitamins that were in the AREDS study and the AREDS 2 study, but much more. It's a complete multivitamin and eye vitamin without any of the bad stuff. We've actually revised this formula 14 times over the last 20 years based on the latest science. The saffron studies, the bilberry studies, the B complex studies, the lutein and zeaxanthin isomer studies, the astaxanthin studies, the taurine studies. We've put everything into this formula. So remember, Fortify Macular Defense acts as your multivitamin and eye vitamin. It is not a cure-all for macular degeneration. It is not a treatment. It gives you the nutritional support that your eyes thirst for. You still got to see your retina specialist or your eye doctor per their instructions. All right, we got a lot of people on hold. Let's go to the first call. I think it is Joe. Joe in Ocala. Good morning, Joe.
Hey, Dr. Lange, I've got a question for you. I've always been wondering. I've been doing this for a few years now. One contact lens in the left eye and no contact lens in the other, and that gives me a pretty effective vision experience, and I don't need bifocals.
Mm-hmm.
I was wondering if that's good for you for the eye that's not getting the contact lens.
Right. So that's called monovision. One eye is for distance and one eye is for near. Okay.
Yeah.
So are you wearing a contact for distance or a contact for near?
One for distance and none for near.
Right. So you're nearsighted. So you see good up close without contacts, don't you?
Correct.
Right. So you're taking preferably your dominant eye and using that for distance. Okay.
Yeah.
And, we've been doing this for, ever since, I've been in eye care, and I think it's fine. But if you're going to be out driving at night, you're going to be participating in any sports and you're competitive, like golfing or tennis or pickleball or mountain biking or riding a motorcycle, driving at night, you should probably wear a contact on both eyes. Because remember, when you have monovision, you have no binocularity, you have no depth perception, okay? Now, that's fine for going to work and walking around the house and doing the majority of your daily activities. But if you really want to have great performance, you got to have them on both eyes. But then you won't see up close. You need reading glasses. However, Joe, there are some good new generation multifocal contacts on the market. You might want to talk to your local eye doctor about being fit in a multifocal. That allows you to see in the distance in both eyes, up close, and everywhere in between in both eyes.
Oh, I didn't know that. Thank you, sir.
Yep.
I just wanted to say one more quick thing.
Uh-huh.
You talk about prayer. I think it's about as effective as throwing poop against the wall and making a wish. I mean, this is the God you're praying to who creates blind babies for sake. So I just wanted to get that off my chest.
Okay. We appreciate your feedback, Joe.
Take care.
All right.
Bye-bye.
Bye-bye. All right. Some people appreciate the power of prayer and some people don't. All right. Sometimes you feel like a nut. Sometimes you don't. That's Mound and Almond Joy, isn't it? All right. So phone lines are still open. 1-877-969-8600. 1-877-969-8600. I do believe in the power of prayer, however. All right. Let's go to, I think it's Bill in Clearwater. Bill, good morning. Welcome to the program.
Hi, I'm Bill. I'm over in Clearwater. I want to ask you a quick question about keeping your eyelids clean.
Mm-hmm.
Is there like a natural way to do it? Some people say you can use baby shampoo or, I don't know, maybe even baking soda, but I wonder what you think about that.
Dr. Summerton, you're pretty much an expert on lid hygiene. What do you think about that?
Well, we do. We look at people's eyelids all day long, and there's such a condition as blepharitis, which I imagine our caller here might have been told he had, because it is very common and it tends to be chronic, ongoing. But there is different reasons of why you get it. It can be bacteria, or it can be little, what we call Demodex, and those are little mites. So kind of depending on what is causing it, we have different treatments, but we do use a lot in our office the Optase tea tree wipes, because they will help with the Demodex wipes, the Demodex mites, and they'll also help with just the bacteria. So we generally recommend those, and you can basically, you close your eyes, you wipe right at the very base of where your eyelashes are coming out of your eyelids, and you do that every morning when you wake up. If you are having that kind of infestation of those mites, which you kind of have those itchy, sore, red eyelids, then we tend to do that every single day, morning and night, for a full 6 weeks, and that tends to knock it out. And then we use them, a few times a week as maintenance. And those are those tea tree wipes. And the brand that we actually have on hand is usually the Optase brand. Of course, just general hygiene of washing your face. Women in particular, we want to make sure they take off their makeup at night before they go to bed. We tend to see it more of a problem with women wearing those fake eyelashes. We tend to see that a little bit more there, basically because you can't wash around your eyelids because they'll make the eyelashes come out. So it's just Optase tea tree wipes is one of our favorites.
I like the Optase tea tree wipes. So that's tea tree oil wipes. And you can do it in the morning when you wake up, or you can do it in the evening. A good thing, a little trick of the trade, is do a hot compress beforehand. That will loosen up all the debris and the potential pathogens that are inside these glands and make them come out. And then you clean them off and kill them with the tea tree oil wipe. So you can go to the Fortified Nutrition Center, Bill, that's right there in Clearwater on McMullen Booth Road. And we have them there.
McMullen and Enterprise Road, I think it is.
Right. Right. Yeah. You know where it is. Fortified Nutrition Center. We have those there.
Yeah, I don't have mites. I don't have redness or soreness or
Right.
itchiness, but I want to keep them clean. So one of the optometrists said, you can use shampoo, the baby shampoo.
Yeah. The only problem with baby shampoo, it does have some things in it that probably are, if you do it every other day, baby shampoo in the shower, I think you're fine. But don't do it too frequently, because it can dry out the lids significantly and cause some dry, scaly, almost like a dermatitis on your lids. But they use baby shampoo versus regular soap, because if it gets in your eye, it doesn't burn. But remember, baby shampoo doesn't actually kill the little critters that could be on it, whether it's bacteria, viral, or even mites people can have, and you don't know it because they're microscopic.
Yeah.
But yeah, good
so I
lid
need
hygiene.
the tea tree oil wipes. I need the wipes.
Yep, the tea tree oil wipes are the ones, Optase. I like that. And there's those are our favorite because they're convenient and they work.
All right. Well, look, I appreciate it.
All right, Bill. Take care.
Thank you.
And lid hygiene is so important because that's the culprit of many of the problems with our eyes. People that get recurrent styes on their eyes, hordeolums, chalazions, dry eye, is related to oftentimes poor lid hygiene, because whatever the germs that are on your eyelids get into these meibomian glands and can clog them up. Also, a good omega-3 fish oil is very important, because that's an anti-inflammatory and it targets the meibomian glands and lowers inflammation in the meibomian glands, thus allowing you to secrete a healthier outer lipid layer of your tear film. But remember, we've preached on this show for years, most omega-3 fish oil you buy over the counter, the best place for it to be is in the garbage can, because most of it has ethanol in it. It's an ethyl ester molecule. They use ethanol in the distillation process, and that can cause gastric upset and irritation of the mucosal lining. So, and it also causes it to go rancid very quickly, and it's very unstable. So when you buy an omega-3 fish oil, make sure it says RTG. That stands for reesterified triglyceride form, or TG, triglyceride form. And of course, Fortify Super Omega or Fortify Super Omega 3 Max is what we recommend. Either one of those. Omega Max, if you're over 200 pounds, Super Omega, if you're under 200 pounds, that's a good rule of thumb. And you can do a quick test. Squeeze your omega-3 contents in a styrofoam cup. If it rots a hole through the cup, it's the ethyl ester version. All right. We're going back to the phones. Let's go to Mary in Bradenton. Mary, good morning. Welcome to the program. Morning, Mary. Mary, you are on the air live. All right, Mary fell asleep. Mary, call back, or we'll try to retrieve you again. We'll put you back on hold and bring you back in just a second, so stay tuned. Once again, 1-877-969-8600. That's 1-877-969-8600. Mary, give us a call back. We had a faulty connection, and we will certainly take that call in a New York second if you call us back at 1-877-969-8600. Remember, for those of you that are in Ocala, we have the Lange Nutrition Center upstairs in the old Lange Eye Care building. It's only a 2-story building on State Road 200. It's right across the street from the Paddock Mall. It's 3101 State Road 200 or 3101 Southwest College Road. Go up the elevator, and that's the Lange Nutrition Center. Also, both Dr. Yang and Dr. Yang, MDs from China, which are acupuncturists and Chinese medicine experts, are upstairs. Hear More Medical is upstairs. Dr. John Poser Plastic Surgery is upstairs. We have Reboot. We have neuropsychology, everything upstairs. So come on by 3101 Southwest College Road. And also we have Fortified Nutrition Center in Clearwater, right on McMullen Booth Road in the Bayside Bridge Plaza. That's right where Publix is, and you can't miss it, Fortified Nutrition Center. And we're open on Saturdays there until 3 o'clock. All right, let's go back to, I think we got Mary back. Mary, thanks for holding. Good morning.
Good morning, Dr. Lange. Thank you so much for all you do.
My pleasure.
And prayers for your brother Rick. I believe in God.
Thank you.
The reason I'm calling is I recently went, I'm 68 years old. I recently went for an eye exam. And I asked for the optomap.
Mm-hmm.
And around here in Manatee County, it's like they don't know. They look at you like, what's that? So I got an OCT test. Is that similar to the optomap?
Not really. An OCT is a good piece of technology. I mean, we use that too. The OCT basically looks at the posterior pole. It doesn't look at the peripheral retina. The whole idea behind the optomap, it goes way out into the corners of the retina, looking for any small holes and tears that maybe the doctor could miss with his indirect ophthalmoscope and the microscope. But the OCT is good technology. It analyzes the central part of your retina, looks at the macula and the optic nerve, and it's great technology. And I think that's certainly better than nothing. But Dr. Summerton, I would not say that the OCT does the same stuff as the optomap, would you?
Right. It is a great piece of technology, and we use it every day as well. But it is giving us that zoomed in picture of the center of your eye. So if there's something like macular degeneration, it will pick that up. But it's the more things that are far out giving us the big picture that it doesn't get. So it's helpful to have both.
Yep.
So they came up with epiretinal membrane. Can you talk a little bit about that?
Sure. There's really 4 names for that: epiretinal membrane, macular pucker, cellophane maculopathy, or macular wrinkle, retinal wrinkle. And that's related to oftentimes a little tension on your retina, a little traction from the vitreous pulling on your macula, and it creates a little wrinkle in your retina. And nothing needs to be done if your vision really isn't bad. If it's not creating a hole in your macula, and let's say your vision's 20/40 or better, you probably don't need to do anything. However, if your vision gets worse, then sometimes they can go in and do an epiretinal membrane peel. A competent retina specialist can do that. But remember the old saying, if it ain't broke, don't fix it. And the OCT is the best technology to monitor the epiretinal membrane. So I would have that done annually or per your doctor's instructions. And since you have an epiretinal membrane, that should be covered by your insurance, and you shouldn't have to pay cash for that.
Yeah, they're saying the Medicare, you get that done first before the cataract surgery. Is that true?
Well, I mean, you can do it before or after. I mean, you'll do it afterwards so you can monitor it. But yeah, it's a good idea to do it before, because that way you know if the macula is in good shape before you've had cataract surgery. I agree.
Okay, thanks a lot. Have a good week.
Thanks for the call. Well, Susan, time went pretty fast. You know, I want to mention something really quick on macular degeneration. One other supplement is curcumin. And curcumin, we have next gen fortified curcumin. It's been shown to help with drusen, hasn't it?
It does, and I think maybe we can touch on that next time, is the herbs that are good for the eyes. We talk about the foods, but saffron, turmeric, rosemary, we can get into more of that later.
I think we would. I think we'll do that. So you got 25 seconds to tell everybody goodbye.
Everybody have a wonderful, healthy day. Enjoy some sunshine outdoors.
And remember, we're running the BOGO, buy one, get one free on our world famous Fortify organic blue-green superfood on the website and the advanced retina formula. With that, I'm out here. Thanks for tuning in. God bless you and God bless America. See ya.